Baba, look at this! We just went in for a broken arm, but this bill? It has more zeros than my math homework. How is this even possible?
I know, little one. It looks like a phone number, doesn't it? The truth is, that piece of paper hides a massive, invisible world.
Many factors contribute to why healthcare is so expensive.
Like what?
Wow, this place is huge.
That's the first reason. A hospital isn't just a building, it's a mini city. Think about it. You don't just have doctors, you have nurses, receptionists, cooks, security guards, cleaners, and managers. All of them need to be paid to keep this city running.
Do they ever close? Like the grocery store?
Never. A hospital is open 24 hours a day, 7 days a week, 365 days a year. Imagine the electricity bill alone. Keeping the lights on, the air perfectly clean, and emergency rooms ready for anything at 3 a.m. costs an absolute fortune. And because human lives are on the line, you can't hire just anyone. You need highly trained professionals. A massive chunk of the money you pay goes directly into the salaries of the thousands of people working in shifts to keep patients safe.
Whoa, what is that giant donut machine?
That's an MRI machine. It takes pictures of the inside of your body. It is an incredible piece of technology. And it costs millions of dollars to buy just one.
But there are machines in every room.
Exactly. Modern medicine is a miracle, but miracles are expensive. Heart monitors, robotic surgery arms, CT scanners, the materials and the computer brains inside them are cutting edge. When you pay a hospital bill, you are renting time on millions of dollars worth of equipment.
Oh no, it broke.
And you can't just put duct tape on a life-saving machine. Hospitals have to hire specialized engineers just to maintain and calibrate these devices daily. If a machine fails, someone could get hurt. So the upkeep is almost as expensive as buying the machine itself.
Being a doctor looks exhausting.
It is. You don't just wake up and decide to be a surgeon. It takes 4 years of college, 4 years of medical school, and then 3 to 7 years of residency. That's more than a decade of studying.
Wait,
4, 5 years?
that's forever.
It takes many years of dedicated study to become a doctor, child.
That mountain is terrifying.
That is the mountain of student debt. Medical school is incredibly expensive. Many doctors start their careers owing hundreds of thousands of dollars. Part of the reason doctors charge so much is that they spend the next 20 years just trying to pay off their education.
Okay, so hospitals and doctors are expensive. But what about this tiny pill? Why does it cost so much?
Think of finding a new medicine like searching for one specific key in a giant pile of millions of keys. Scientists spend years just looking for the right chemical compound to fight a disease.
Oh, the scientist looks so sad.
For every one medicine that makes it to the pharmacy, thousands of others fail. The pharmaceutical companies spend billions of dollars on the ones that don't work. When you buy a pill that does work, you are also paying for all the failed experiments that led up to it. Even when they find the right key, it takes an average of 10 to 15 years of strict testing to make sure it's safe for humans. They have to prove to the government that it works without dangerous side effects before a doctor can prescribe it to you.
Okay, I get it. But doesn't insurance pay for this?
Ah, insurance, the triangle of confusion. In a perfect world, insurance is a simple idea. You, the hospital, and the insurance company working together.
Oh, like everyone putting their allowance into one big piggy bank?
Exactly. Everyone pays a little bit into a big pool every month. Most people stay healthy, but if someone gets really sick, the pool has enough money to pay for their expensive care. It's a great idea, in theory.
Why am I in a maze made of paper? My head spins.
Because the reality is complicated. Insurance companies want to make sure they aren't paying for things they don't have to. Hospitals want to make sure they get paid for everything they do. The result? A massive maze of coding, billing, arguing, and paperwork.
It's a monster.
We call it the bureaucracy monster. Hospitals have to hire armies of billing experts just to fight with the insurance companies' armies of billing experts. All of this arguing and paperwork costs billions of dollars every year. and none of it actually treats a sick patient.
Look, Grandpa is on the timeline.
Now for some good news. Because of all this expensive technology and amazing medicine, humans are living much, much longer than we used to. We are surviving diseases that used to be impossible to cure.
But now there's a giant line.
Exactly. Because we are living longer, our bodies wear out over time. Older people need more doctor visits, more medicine, and more surgeries. The demand for healthcare is growing faster than ever before.
Wait. If we pay more, does that mean we get the best care in the world?
That is the million-dollar question. Sometimes yes, but often higher prices don't mean better health. Sometimes it just means the system is confusing and charging you for things you don't really need.
Baba, the money is falling down the drain.
That's waste. Unnecessary tests, administrative delays, and complex pricing mean that a lot of the money we spend on healthcare is simply wasted before it ever helps a patient.
It might seem confusing at first, but look, the hospitals, doctors, and insurance all work together to help the elderly patients. See how it connects?
I get it now. It's not just one thing. It's a whole web of expensive things all tangled together.
Exactly. The system is a miracle, but it is a messy, expensive miracle. Fixing it won't be easy, but understanding the puzzle is the first step. And that's the big picture.
If you liked learning with us, hit that subscribe button.
What complicated topic should we explain next? Let us know in the comments below. Thanks for watching, and stay curious.